And so the reason that cats are so prone to getting vascular disease is largely because they have a lot of other predisposing diseases that affect their vascular system. And so the ones I always talk to people about that we want to screen for are cardiac disease like HCM, renal disease, hyperthyroidism, and hypertension. So pretty much any animal that had a big infarct, we're going to be screening for all of those diseases. So sometimes even if they don't have a heart murmur, we'll do an echo on these guys. And so hallmark signs of vascular disease, they're going to be very acute. So usually they're going to have signs that are going to be happening within hours. And then after the initial onset of signs, they really should be stable or even getting better after about 12 to 24 hours. I say there's a little window in the beginning that some will decline within the first 6 to 12 hours. We suspect it's because they've had that initial loss of blood flow and they can get a little rim of edema around that infarct that can make them a little bit worse. But if you have an animal that's progressing over the course of 2 to 3 days, it'd be very, very unlikely for that to be an ischemic infarct. The other key hallmark sign is it's almost always going to be lateralizing. So oftentimes it's going to be much worse on one side than the other. Again, because of that distribution of blood flow affecting one side of the brain or spinal cord versus the other. And then it should not be painful. So we see them very commonly in the spinal cord in cats. And so one differentiating factor from like a disc herniation or a tumor is that it should not be painful. And so the symptoms we see largely depend on where they've occurred. So we see them very commonly in the cats in the brainstem and cerebellum. So oftentimes going to have ataxia, tetraparesis, obtundation with those things. And then also, again, very commonly in the spinal cord, both in the cervical spinal cord and the thoracolumbospinal cord. And I'd say oftentimes when we get thoracolumbar spinal cord infarcts, they get confused with saddle thrombus. So again, ways to differentiate between those things are going to be feeling for your pulses in your pelvic limbs, checking VGs in the pelvic limbs, feeling the warmth of your pelvic limbs compared to your thoracic limbs. So want to make sure you're not dooming a cat to having a saddle thrombus that actually has an infarct. And so diagnosis, oftentimes, when we suspect an infarct, we're going to want to, again, rule out all the other diseases that can predispose them to having it. So you're not going to do anything specifically to treat an infarct other than give it some time. And so most important thing is making sure we're trying to treat any sort of systemic disease that could predispose them to have another one. So doing blood work, including T4, UA, blood pressure, super important to do, chest rads, echo, kind of depending on your patient and the finances of the owner. And then when we do MRIs, typically we're going to see what we saw with Jay, these very well-defined wedge-shaped lesions that shouldn't have any contrast enhancement or at least very minimal contrast enhancement. And I'll say a lot of the times we're not doing MRIs in cats that we suspect have had a vascular event, mainly because if they have another predisposing disease, that's going to make them prone to having vascular events. It usually makes them not the best anesthetic candidate. So I'll usually kind of weigh everything out as to whether or not we want to risk getting an MRI. So for a lot of them, if we suspect an infarct instead, I'll just recommend giving them some time. And then if they're not improving like we would expect, then we can consider further diagnostics. And so treatment for these guys really is just time. It's waiting for new blood supply to come into the brain or spinal cord to get that input back. In some animals, if they're going to be willing to participate, you can do physical therapy. Some cats do better than others, but especially if you have a significant infarct affecting the spinal cord, you're going to want to make sure you're doing massaging, range of motion, things like that, so we can keep good blood supply to the limbs and don't get those joints too stiff. Acupuncture can help in some patients. And then depending on the cat, sometimes we'll just do a single dose of dexamethasone. That basically is going to try to reduce any sort of edema around an infarct. So usually only really need to give one dose. But just be cautious if the patients have renal or heart disease. Sometimes it's a bit risky to give a dose of a steroid. And then the recovery is really kind of depend on where the infarct has occurred and how big it is. And so ones that are occurring in the brainstem, where a lot of the centers for alertness are and motor function, are going to have a slower recovery. And also depends on size. So if you have a really big infarct, obviously, especially in an important part of the brain or spinal cord, the recovery is going to be slower. And so this is an example of an animal, unfortunately, did not have a good recovery because we're looking at a histopath section. But this is just showing a massive infarct that affected the spinal cord. So this is an area where there's complete loss of blood supply within the spinal cord. This is an example of a really massive infarct on an MRI in a cat in the cervical spinal cord. And so what I'll usually tell people is that they really can look pretty bad in the beginning, especially if they've had a pretty big brainstem or spinal cord infarct. But a lot of those animals can get better if you just give them time. And so as long as they're not significantly debilitated or having any problems with breathing, things like that, I really just recommend giving at least a week and reassessing them. So I've had animals where owners were on the cusp of euthanasia, and by a week later, they're significantly improved. And so I try to have them, instead of focusing on what's happening hour to hour, what's happening day by day, really think of what's happening week by week. So this is Monday. How do we look next Monday? And then reassess. And that gives you an idea of what their trajectory for recovery is going to be. And if they're making significant recovery 1 week later, then give them another week. And then you get a good idea of how they're going to move going over time.